Oh, we're live and no one's watching. All right. We're going to read to you from, let's see, The Divided Mind. We're going to pick it up where I left off. Tension, page 25. Tension headache and migraine headache. There is no laboratory proof that tension headaches and migraine headaches are psychosomatic, but the clinical experience of treating them as such is impressive. As early as the 1930s and 1940s, leading medical authorities published numerous papers on the psychological basis for migraine, and all noted that migraines were related to repressed rage. In Psychosomatic Medicine 1950, Franz Alexander noted, "The most striking observation is the sudden termination of the attack almost from 1 minute to another after the patient becomes conscious of his hitherto repressed rage and gives expression to it in abusive words." Note Alexander's reference to rage. As will be seen, rage in the unconscious mind is central to understanding virtually all psychosomatic reactions. The groundbreaking work of Alexander and his colleagues, see Chapter 2, has been forgotten. The patients who come into our clinic report that the treatment they have previously received for their migraine or tension headaches is invariably with medications, another example of the regression of contemporary medicine. I can't even pronounce this word, Mindbody Syndromes. Genitorinary. Okay, here we go. Mind-body syndromes. The perceived need for frequent urination. Oh, check this out. The perceived need for frequent urination is psychosomatic, except when it is related to diabetes, renal, cardiac, or adrenal disease, bladder infection, or an enlarged prostate. It is very common. A careful history will reveal that in many cases, the habit of getting up frequently during the night to urinate is not brought on by a full bladder, but by a mild form of insomnia. The person is programmed by the unconscious to awaken and then programmed to have the urge to urinate. It has been documented in the medical literature that prostatitis in young men is commonly related to stress when not due to an obvious infection. Most sexual dysfunction is psychologically based at any age. Most sexual dysfunction is psychologically based. That's interesting. Most sexual dysfunction is psychologically based at any age. Though it is well known that libido decreases with age, emotional factors may still be responsible for sexual difficulties in the elderly. Dizziness and vertigo. Both of these conditions may be signs of disorders of the nerves or the ears, but they are most commonly benign and psychosomatic. I once experienced vertigo that lasted only a few hours. It ended when I was able to identify the psychological basis for it. Disorders attributed to activity of the immune peptide system. The disorders described up to this point are the most common of a very large group, all of them activated by the autonomic peptide system. A second group of ailments is associated with the body's immune system. Again, we include the peptide communication system because of the role it plays in the interaction between brain and body. It is not known what determines the unconscious mind's choice of which symptom or symptoms to employ, but it makes no difference since the purpose of all symptoms is the same, to distract the conscious mind. Oh, that's important. But it makes no difference since the purpose of all symptoms is the same, to distract the conscious mind. With the immune peptide system, the disorders may be induced by either overactive or underactive immune function. Overactive immune activity leads to allergic phenomenon, allergic redness, a large number of skin problems. Hey guys, nobody's watching. Go ahead. Baby, check this out. This is really cool. The perceived need for frequent urination is psychosomatic, except when it is related to diabetes, renal, cardiac, or adrenal disease, bladder infection, or enlarged prostate. It is very common. Mm-hmm. With the immune peptide system, the disorders may be induced. All right, I'm coming.